All right, today we're jumping into a real medical thriller. It's a high stakes emergency where the clock isn't just ticking, it's screaming. We're talking about acute renal ischemia. So, what does happen when one of your most vital organs suddenly loses its blood supply? It's a scary thought, right? And when that organ is your kidney, it kicks off an absolute crisis inside your body. Let's dig into what that really looks like. So, what are we actually talking about here? Acute renal ischemia. It's basically a sudden, total shutdown of blood flow to one or both of your kidneys. This isn't some slow, gradual thing. Nope. It's like flipping a switch, and it can cause irreversible damage, like fast. We're talking about turning a perfectly healthy organ into tissue that just doesn't work anymore. And that right there, that's the whole ball game. Because with this condition, everything, and I mean everything, boils down to the clock. This quote really just nails the challenge for doctors. Think about it. It's not enough to just know the treatment. You have to be suspicious enough to even think of this rare condition. Then you have to diagnose it at lightning speed, and then you have to act right now. There is absolutely zero wiggle room here. Okay, so this chart, wow, it really paints a picture of the damage. So serum creatinine, that's a key marker for how well your kidneys are working. The higher the number, the worse the news. And just look at that jump between 60 minutes, 90 minutes, and 120 minutes. It's not a gradual slope, it's a sheer cliff. That's a kidney literally failing in real time. 70 to 80%. Let that sink in. After just 1 hour of what's called warm ischemia, that's when blood flow is cut off inside the body at normal temperature, a kidney can lose almost all its function. I mean, sure, some recovery might be possible, but that just shows you how incredibly fast and devastating this injury is. So that brings us to the magic number, or the tragic number, really. 90 minutes. That's the tipping point. You go past that 90-minute window and the odds of saving that kidney just plummet, even if you manage to get the blood flowing again later on. It's a brutal deadline. So, the big question is, what causes something this sudden, this catastrophic? Let's go play detective and unmask the hidden culprits. All right, our number one suspect is what's called an embolism. That's a blood clot that plays tourist. It travels from somewhere else, usually the heart if someone has atrial fibrillation, and gets stuck in the kidney's main artery. But that's not the only way this can happen. You can also have a clot that forms right there on the spot, a tear in the artery wall, a physical injury, or it could even be an unintended consequence of another medical procedure. But wait a second. Is a sudden blockage always a total disaster? Well, here's where things get really interesting. Turns out, the body sometimes has a secret weapon up its sleeve, a defense mechanism that can completely change the game. And this slide shows you exactly how. It's all about speed. A sudden acute blockage is like a massive pileup on the highway. Everything just stops, no warning. But if that artery narrows slowly over months or even years, the body is smart. It starts building detours. These are called collateral arteries, and they're basically natural bypasses. So if the main road eventually closes, traffic can still get through. In those cases, a total blockage might not be the catastrophe you'd expect. So, because this thing is so rare and the clock is ticking so loudly, figuring out what's going on is like some serious, high-stakes detective work. Let's look at why this medical mystery is so hard to solve. The problem is, the clues are total masters of disguise. A patient comes in with pain in their side or back, they feel sick, maybe their blood pressure is through the roof. What's the first thing you'd think of? Yep, kidney stones. It's the classic presentation. And that misdirection is so dangerous. Because every second spent thinking it's a kidney stone is a second the real problem, the lack of blood, is just silently killing the kidney. And if that wasn't tricky enough, here's the ultimate trap. That key blood test we talked about, serum creatinine, it can come back totally normal in up to half of all cases. Why? Because the other healthy kidney is picking up the slack, working overtime to compensate. This gives everyone a false sense of security, all while that time bomb is still ticking away. This is exactly why you have to get a picture of what's going on. You can't just rely on blood tests. And when you look at the diagnostic toolkit, there is one clear hero in this story, the CTA scan, or CT angiogram. It's fast, most hospitals have one, and it's fantastic at showing you a roadmap of the blood vessels and pointing right to the roadblock. It's the tool that cracks the case. Okay, so the mystery is solved. Now the fight begins. And it has to begin right now. The game plan is actually pretty straightforward. Step 1, suspect it. That high index of suspicion is key. Step 2, image it. Get that scan to prove what's happening. And step 3, intervene. Do something to restore that blood flow, and do it fast. And believe me, doctors have a pretty amazing arsenal to fight back. First up, they'll usually start you on heparin, a blood thinner, to keep that clot from growing. But the real high-tech stuff is endovascular treatment. This is where they go in through your blood vessels with tiny catheters. They can use them to deliver clot-busting drugs right to the problem, literally vacuum the clot out, or even use a tiny balloon to open the artery and place a stent to keep it open. Big open surgery? That's pretty rare these days, really a last resort for the toughest cases. So we've covered the culprits, the tricky clues, and the incredible ways doctors fight back. What's the one thing you absolutely need to remember from all of this? It all comes down to this. You've probably heard the saying, time is brain, when talking about strokes, right? Well, here, time is kidney. It's the exact same idea. Every single minute that goes by without blood flow means more kidney tissue is dying. It's gone forever. So time isn't just a factor, it's everything. And that leaves us with a pretty chilling final thought, doesn't it? When you think about how much this looks like something common, like a kidney stone, and how a key blood test can lie to you, you have to wonder, how many cases like this just slip through the cracks? How many people lose a kidney, not because there was nothing to be done, but simply because the clock ran out before anyone figured out what was truly wrong?